righty, good afternoon from Macomb City Hall. It's Macomb Mayor Mike Inman. It's the 25th day of March. Just 9 months from today, we'll be celebrating Christmas, not to get too far ahead of the game there, but we have the latest update from the McDonough County Health Department and some other information. First of all, we know it's been quite a while since we last had an opportunity to get together due to some scheduling issues here at City Hall and spring break and some other things going on. We're sorry, but we're here now. So again, the most latest information from the McDonough County Health Department, this was shared late yesterday afternoon, and that what we'd like to share with you is that there's been a consistently low volume of cases in the county being reported. I think that's good. Some anecdotal information sharing from our county partners would tend to state that's because we're getting vaccinations out and people are taking advantage of being vaccinated, and there seems to be some anecdotal evidence that that's what's playing into the overall numbers. And so just to report, as of yesterday, late yesterday afternoon, there are 21 active cases in the county, a total of 2,381 confirmed cases since the onset of the pandemic, and unfortunately they're reporting an additional death since we last had an opportunity to gather, and we would share our condolences with the family that's lost a loved one to COVID-19 and to all the folks that have suffered the loss of someone from COVID-19 since the onset. So again, 21 active cases here, and we're talking specifically about the vaccines and how it's playing a part in this overall, believed to be overall trending down. So a total of the number of vaccines administered to 65-year-olds and older in the county is 6,019. The number of vaccines administered to folks 16 to 64 years old is 5,735, so a total of 11,754 total doses of vaccine given in McDonough County, and that's from all sources. Hy-Vee has played an important role in that. Walgreens is now on board with that, and of course the health department has been offering vaccinations since the latter part of December. So the important part is that almost 5,000, or in other words, 4,831 people have received a total of 2 doses, so they're completely vaccinated from the virus. So as we continue to talk about some of the other positive things as it relates to vaccines, Governor Pritzker, since we last talked, developed and shared metrics with the state on bridging from phase 4 to phase 5 of the Restore Illinois plan. So the bridging components have some metrics that have to be met, and then we would, so let me run through those with you. For example, in order to start bridging from phase 4 to phase 5, 70% of 65 and older population, that's the entire state population at 65 and older, 70% of them have received 1 dose of vaccine. So currently, we're just at 67% today, just shy of 67%, and that seems to be taking about a 1% increase per day. So you can do the math there. If we're at 67 today and at 70%, we start this bridging from phase 4 to phase 5. And that phase 4 to phase 5, when the bridge takes effect, there'll be some lesser restrictions on mitigation. And all that information is available at the Restore Illinois plan, and you can look over that matrix here, and that address is at the bottom of your screen now. That would then begin a 28-day monitoring period. So the state IDPH would still continue to look at hospital bed availability overall, ICU bed availability, the trending rate of overall positivity. And currently, for example, our region of the state is at 3.6 positivity rating. Excuse me, the entire state is as of yesterday. And the idea being is that during this 28-day period, if the variant should suddenly take hold and start creating more hospitalizations or something like that, it would be picked up. But the idea is that once we get to 70% of 65 and older that have had at least 1 dose, that's in the entire state population, and again, well, that's trending about 1% a day. So again, mathematically, that's about 3 days from now. We would start a 28-day observation period, and during that 20-day observation period, the state would also be monitoring and looking at getting 50% of the 16 and older population vaccinated. And you'd say, well, where are we at today? We're at 32%, so 18%. And again, according to the IDPH folks, we're trending about a percent every other day and making that headway towards that 50%. So we're talking about 18, 20, 25 days from now. Again, this is me speaking, but mathematically you could do it. And if we were to maintain these trends, we would come out of that 28-day phase about the same time we got to that 50% level of vaccination for 16 and older. That's one dose. So I don't want to confuse you too much with all these numbers, but it's very encouraging information. The bottom line is that we have to still do mitigation, still have to wear face masks if you have not been vaccinated. The CDC also, since we've met, has offered some additional guidance on the wearing of masks, so that in small groups, people who have received both doses of vaccine and have been beyond the 2-week waiting period after receiving the last dose can now meet in small groups inside without masks, without face coverings, without social distancing. So an incentive, if you will, to get vaccinated. The sooner we can, I think most folks feel the sooner we can be without masks, the better we'll be as far as back to normal, so to speak. So those are the matrix. 70% of 65 and older, then we start the bridge. Once we get to 50, which is will trigger a 28-day cycle and during that time, monitoring cycle, and during that time there'll be a reduction of mitigations. And then at the same time, they'll be tracking the percentage of the population that has received at least one vaccination that is 16 years of age and older. Once we hit the 50%, then we'll go into phase 5. And phase 5 is virtually no mitigation at all. So again, hopefully optimistic about how we're trending. All that information is available at the Illinois Department of Public Health website, and you can monitor the trends of all those metrics as we proceed forward. Again, some of the keys are we still have to test. Testing is still a component here. Right now, the McDonough District Hospital has expanded their hours on the weekends for their drive-through testing program. Again, a brand new facility out there, brand new building, all climate controlled inside. I had a chance to tour it here a couple of weeks ago. Really a positive improvement in the testing process. Still the same wonderful folks at MDH running it, but the environment inside is a little nicer. And that's located at the southeast corner of the campus. There's new signage up directing you to it, and a very good operation at MDH's campus for testing. And those hours for testing are on your screen now, Monday through Friday, and then the weekend hours have been expanded by 1 hour. It's now 8 to 1. So again, those hours for testing at MDH are there on your screen. IDPH is not doing any statewide coming in mobile testing right now. There's a possibility that will change, but they've pulled back on that a bit, and but still encourage folks to be tested. Don't need a doctor's order, don't need to have symptoms. You want to be tested, they'll get it taken care of at MDH. The other component I want to share with you is that we mentioned it a few minutes ago. The health department is still offering vaccinations, and many of those groups have expanded since we last talked. And one of the provisions that the governor announced 10 days ago or so was that as of April 12th, everyone, regardless of their health status, where they work, whatever, would be eligible statewide to receive a vaccination. So if you've not met any of the criteria to receive it now, and that's expanded since we talked last, and if you want information, that's also available at the IDPH website. Or you can go getyourcovidshot.com, and that will get you registered, and the matrix will be laid out there as whether right now if you fit into a category, with the understanding that you should be ready. If you've not fit into any of those categories up until now, you should be getting ready, because April 12th it will be available. And we most assuredly would encourage you to avail yourself of getting vaccinated so that we can all meet these metrics and move into phase 5 where no further mitigation is necessary. So as well as the getyourcovidshot.com, we'd also make you aware that Walgreens, as we said earlier, and Hy-Vee are both administering the vaccines. Hy-Vee has done an exemplary job, kind of an unsung sort of effort here, and We appreciate what they've done. But those websites are located at the bottom of your screen now. So both for Walgreens and for Hy-Vee, and I would look to sooner or later both Walmart and CVS will join that list. Until now, they're not on it, but Walgreens and Hy-Vee sure are, and those contact links are on your screen now. We'd also hearing some encouraging discussions amongst county partners, particularly the hospital and the health department. They're looking at sponsoring and setting up the logistics, and there'll be word coming when that happens, but the talks are ongoing about a large-scale mass vaccination opportunity coming up in the near future, likely on or close to that April 12th date. Again, we don't have any of those particulars right now. They're not solidified, but when they do, we'll get those out to you. But be prepared. We want folks to be vaccinated. And some of you are like I am. You've already received both doses of your vaccine, and you're feeling good, and you're enjoying some of the benefits of reduced mitigation. We'd also like to remind you that as we continue, there are still folks that are homebound and still trying to do their best with coping with the stay-at-home order, the mitigation efforts, and everything else. Again, keep those folks in your thoughts and prayers, and if you can visit them either by phone or electronically or in person safely, we would encourage you to do that and make sure that you're reaching out to those folks that still are having a rough go of things here as we try to deal with COVID-19. The encouraging word is, since we talked last, we're making some headway. Vaccines are becoming more widely available. Opportunities are increasing for more people than not. That continues in a trend we believe in the right direction. Significant light at the end of the tunnel. And we'd also remind you that last week the City of Macomb and the Macomb Area Convention and Visitors Bureau and the Heritage Days Committee made a determination that they're proceeding with plans for Heritage Days 2021. And with the idea that caveat, we'll have to be in phase 5 for that to be carried off, but they're hopefully optimistic, as we are here at City Hall, that we will be in phase 5 well before the third full week in June, when Heritage Days 2021 will take place. So again, a bit of encouraging news as we look towards turning the corner here and dealing with COVID-19. As always, if you have any questions and think we can be helpful to you here at City Hall, the numbers that will appear on your screen after we're concluded with this video portion and I get done talking, please feel free to call us here, whether it's Office of Community Development, Downtown Development, City Administrator, myself at City of Macomb, mayor at macomb.com, or call the number listed for the mayor's office, and we'll be happy to try to answer any questions you may have and give you some reassurance that we are indeed headed in the right direction. So keep up the good work. Still got to wear face masks and social distancing and wash hands. That's still part of it until we get a little farther down the road. But again, we're cautiously optimistic we're headed there. So until the next time, thank you for joining us.